Hello, everyone. We are so happy to have you with us today. My name is Linda Williams, and I am a community outreach and training manager with Consumer Action. Welcome. I really want to thank you for joining us for today's event, COVID-19 Scams and Healthcare Fraud. Today's webinar is part of a series of webinars that Consumer Action will be hosting in response to that God dreaded COVID-19 crisis. But mark your calendars for several great upcoming webinars. Estate planning for healthcare, finance, and more during the pandemic is set for August the 5th. Tracking COVID-19 economic devastation is set for early September, and we have two guest speakers coming in from Georgetown University that's going to look at the devastation and employment in certain job sectors. The impact of COVID-19 on domestic violence and financial abuse is scheduled for October the 6th. And on November the 17th, we will have a webinar on the impact of COVID-19 on the mental health of children, as well as how to protect kids' privacy when they are learning online and at home more and on these games. I should note that our work on COVID-19 crisis education project is made possible by a grant from Wells Fargo. And on behalf of all of the entire staff at Consumer Action, we would like to thank Wells Fargo for its support. Now, I have a few housekeeping tips for you. You can use the question function to ask your question. We ask that you hold your questions. We're going to ask that you hold your questions until the end of the webinar, but you can use the function to put your questions in. My coworker and co-trainer Nelson Santiago, he's going to be capturing those questions as you put them in, and he's going to present them to our fabulous guest speaker at the end of the webinar. You can also ask your questions on Twitter. Our organization's handle is at Consumer Action, or you can use the hashtag CA webinars. Now, this webinar is being recorded. All of the handouts will be placed in the Dropbox and will be made available to you tomorrow afternoon. Now, before I go over the agenda for today's webinar, please allow me to tell you a little bit about what we do at Consumer Action. Consumer Action is a national nonprofit that has served consumers since 1971. I am still remember the campaign that Consumer Action had when it was keeping grocery stores from selling dented food cans or canned goods to low-income consumers. To this day, I won't buy a dented canned good. We enjoy a national reputation for creating multilingual consumer education materials in the area of credit, banking, privacy, utilities, insurance, and telecommunication. All of those kitchen table, pocketbook issues that impact you, your family, your neighbors, and the communities that you serve. You can go to our website at www.consumer-action.org and take a look at the wealth of information that's available on our website. You can use the quick menu bar. For an example, if you select the language, you can find materials in English and Spanish and Chinese. You can select a subsite and you can go to our Managing Money project and find information on banking, credit card fraud, debt collection, identity theft. And if you're interested in a training module, you can click on that tab. And for an example, if you wanted a training module on identity theft or debt collection, you can download the PowerPoint slides, the leader guides, the fact sheets, all of the information that you would need. We are a 501c3 organization that's supported by membership, donations, and grants. And for $25 a year or $15 if you are a senior like me, you can become a member of Consumer Action. And that money will help us continue some of our vital work. Now, at the end of the webinar, there will be some information about how you can make a donation to Consumer Action. So let me just go over the agenda quickly. We are opening up the webinar by testing your knowledge of current events for one of our popular games, How Much Do You Know? following the game, we will move into our feature presentation, COVID-19 scams and healthcare fraud. And if you haven't heard this speaker, our guest speaker, Micki Nozaki, you're in for a treat. She has tons of information for you, and she's a great speaker. So following her presentation, Nelson will come on and he will present to Micki your questions. We will answer your questions, and then we will wrap up. So let's get started with the how much do you know game. Let's launch our first question to find out how much do you know. Okay, so true or false? Since the COVID-19 outbreak began, the top complaint categories are travel, text messages, and imposter scams. Now, is that true or is that false? Don't overthink it. Just click true or false. Couple more seconds. Okay, let's look at the results. Oh, 50% says true and 50% says it's false. Well, if you said it is false, you are incorrect. I'm sorry. That is true. Let's launch the next question. According to the FTC, COVID-19 related scams have cost Americans 13.4 million so far this year, and we're in July. Is that true or is that false? Come on, don't overthink it. Okay, let's see the results. 60% said true, 40% said false. Well, I'm sorry, but that is true. The scams have cost Americans 13.4 million so far this year. Okay, let's launch the next question. The Security and Exchange Commission has suspended trading in 27 companies for making misleading COVID-19 claims. Really? Is that true or is that false? Come on, don't overthink it. Couple more seconds. Okay, let's look at the results. Wow, 75% is saying it's true, 25% is saying it's false. I think you're just getting the pattern of how I'm asking these questions. That is true. It is absolutely true. Let's launch our last question. The FTC sent warning letters to 160 companies for selling products that made claims about their ability to treat or cure COVID-19. Now, is that true or is that false? Come on, don't overthink it. Okay, so let's look at the results. 100% says it's true. Well, actually, that's false. And as Micki get into her presentation, you'll find out that the numbers are far greater than 160 companies. So thank you so much for participating um, in the quiz, and let's move on to our featured presentation. Again, our presenter is Micki Nozaki. She is the director of the Senior Medicare Patrol project at California Health Advocates. And again, she has a ton of information for us today. And if you haven't heard her, you're in for a great treat. So let me click this little mouse and turn this presentation over to Micki, because I know you uh, are waiting to hear from her. So, okay, Micki, you can take it away.
All right. Thank you, Linda. Thank you for those kind words. I appreciate it. Welcome, everybody. I am so glad that you joined us here today to talk about COVID-19 scams and healthcare fraud. So here we are in July, and tragically, still in the midst of the coronavirus COVID-19 pandemic, an epidemic that has thrust us into a world of confusion and uncertainty. We're several months since we first heard about COVID-19, and we continue to deal in misinformation and conflicting information. And this confusion triggers anxiety and fear. Now, to underscore this, I want to talk to you about a survey that is being done by the United States Census Bureau, partnering with the National Center for Health Statistics. Ever since April, they've been surveying adults across the country, and by state, they're asking people to report whether they report symptoms of anxiety or depressive disorder during this COVID-19 pandemic. And the data, I gotta tell you, it is astounding. I looked at California, because that's where I am. The California survey data shows almost 40% of the adult respondents to this survey confirm they're either anxious or depressed. And believe it or not, other states reported higher numbers than that. Pretty staggering. And we know all too well that it's our older adults that suffer more from this confusion and fear. Now, according to the CDC, in this COVID-19 world, seniors, unsurprisingly, are at a higher risk of experiencing stress. And that stress shows up as fear, worry, uncertainty, loneliness. And I'll tell you, the criminals, they feed on those emotions. Scammers incite fear by making something sound urgent. They say you need to act now, pressuring people into giving up their personal information, targeting bank account info, Medicare numbers, and Social Security numbers. Now, a perfect example of how the scammers incite this fear by making things sound critical and urgent is the Social Security Administration scam robocall, which, by the way, is rearing its ugly head once again. The scammers scare people into believing that their benefits have been suspended. The robocall warns, quote, "Your case is critical, time sensitive. It requires your urgent attention," end quote. Make no mistake, folks, the criminal scammers are out to steal billions of dollars from Medicare and us and inflict as much harm on our seniors as they can get away with. And if all that fear and confusion isn't bad enough, our elders are isolated, they're lonely, many of them face language challenges, all of which makes them extremely vulnerable. Case in point, our Senior Medicare Patrol toll line last week got a report from an elderly woman who told us she had received a telephone call from the California COVID team. She said that the caller engaged her in friendly conversation in her own native language, but after a while began to pressure her into providing her full name, date of birth, and Medicare number. Just one example of many. The scammers are thriving, and the schemes that we see evolve over time. Now let's take a look at the trends we're watching now. Scammers offering free COVID tests in exchange for Medicare numbers. Providers, doctors, nurses, hospitals who see financial gain in billing Medicare for false claims using COVID as a diagnosis. Increasing telehealth and telemedicine fraud. Scammers who have glommed onto contact tracing to trick people into giving up personal information. The many, many fake websites and charities and hundreds of products making money off of this fear and confusion. Criminal scammers going after people's much needed economic stimulus payments We see the old 2019 genetic testing scam spruced up for 2020. Illicit hospice agencies fraudulently enrolling non-terminal seniors in hospice using COVID-19 as a diagnosis. And finally, the rogue insurance agent or the scammer masquerading as an insurance agent, convincing folks to enroll in a health plan that is absolutely not at all good for the beneficiary, but lines the pockets of the scammer. And we'll go into detail on all of these schemes, but first, I want to take a look at Medicare's new rulings around COVID-19. Now, for those of us who are in the healthcare space, we know Medicare is huge. It's enormous. It's a whole bunch of rules and procedures and policies around payments and coverage and benefits. But unfortunately, most Medicare beneficiaries, those people 65 and older and persons with disabilities, they don't understand the intricacies of the Medicare rules, even in ordinary times. And when you don't know the rules, it's very easy to fall victim to the scammers and the fraudsters. But these are not ordinary times. And the government rules around Medicare COVID testing are evolving. So here are some updates I wanted to share with you in the hopes that we can stop people from falling victim to the criminals when they know the actual facts. So Medicare Part B covers the cost of the COVID-19 test. Beneficiaries do not incur cost sharing for the test. And yet, we hear daily about beneficiaries who are being tricked into paying out of pocket for the coronavirus test. And the testing can occur at multiple locations. That means parking lots, drive-throughs. Sometimes even approved providers can take specimens in seniors' homes. Medicare Advantage plans do not pass on the charges to their members for testing. And Medicare covers not only the coronavirus COVID-19 test, it also covers the COVID antibody test, which more and more people are hearing and recognizing because of the news. Now, the COVID antibody test is the FDA authorized test to help see if someone has developed an immune response and therefore not at immediate risk of COVID-19 reinfection. So Medicare does pay for the COVID-19 and the antibody. So please share this information widely because, of course, the bad actors are already claiming there's a charge for the COVID and the antibody test. And believe me, they're collecting money. Or the scammers will email and text seniors outright lying and telling them the government has mandated that everybody has to take an antibody test. Or the scammer entices people with a promise that, hey, if you take a test, you'll get paid for it. When all the scammers really want is your personal information, the full name, the birth date, the Medicare number, the Social Security number, so that they can fraudulently bill or take money from you. The best advice always, check with your own doctor. Now, unfortunately, some of our seniors didn't check with their own doctor. Now, this is a case we learned of recently about a doctor in Central California. Now, this doctor advertised a very accurate COVID antibody test, which he was delivering at a local junior high school drive-through. You don't even need to get out of your car, he said. He even promoted the test on television. So unfortunately, these ladies submitted to the testing. They had their blood drawn. They even signed some paperwork. Now, they they weren't really quite sure what they were signing. But then they found out they had to pay over $50 a piece out of pocket for the test. And when they questioned it, the doctor told them if they wanted their money back, go bill Medicare by yourself. And to add insult to injury, when these senior ladies got their Medicare summary notices, it showed that the doctor not only billed Medicare under their Medicare numbers for the test, he also billed for an office visit and other services that the ladies clearly did not receive. Now, in another case, also in California, we've heard of several laboratories that are hiring marketers, and those marketers are paid on commission. Now, the scheme goes something like this. The laboratories hire the marketers. The marketers then call seniors on the phone or go door to door, and they try to obtain as many Medicare numbers from as many seniors as they can, because they, in turn, the marketers get paid from the laboratories based on how much the lab can bill Medicare per beneficiary Medicare number that the marketers recruited. So here's an actual case our investigators just shared with us recently. A marketer accosted an older, non-English speaking gentleman in a Southern California coffee shop. Now, the marketer told the gentleman that he could take him to a medical office where he could get a free COVID-19 test. Now, the older gentleman didn't really understand everything the marketer told him, but he did recognize COVID, and he certainly knew the word free. So he agreed to go, got in the car with the marketer. The marketer drove him over 10 miles to some facility, and we don't really know what quite went on at that facility. However, when the gentleman got his Medicare statement, it showed the labs that the marketer was working for had billed Medicare for hundreds of dollars in pneumonia tests. They billed Medicare for over $500 in ultrasound testing. And apparently, the labs even colluded with a podiatrist, shared the gentleman's Medicare number with the foot doctor, and the podiatrist billed Medicare for some $200 worth of skin removal. Now, when the investigators shared this case with us, they told us that not only did the gentleman not get a COVID test, he didn't receive any of these services. No pneumonia test, no ultrasound, no removal of skin. But I got to tell you, Medicare was billed for all that, and Medicare paid those providers. Now let's talk about Medicare and telehealth coverage for a minute. And again, like I say, Medicare's rules around payment and coverage, they're changing because they're trying to accommodate the beneficiaries during this pandemic. So another Medicare covered benefit is telehealth. Now, telehealth, sometimes called telemedicine, they're healthcare methods which clearly get some people healthcare when they wouldn't have gotten it otherwise. So instead of going to a doctor's office, especially during the pandemic, Medicare telehealth offers doctor's visits, psychotherapy sessions, and consults by way of audio and video technology, such as Zoom sessions. And this remote visit, it can occur in the beneficiary's home, in a nursing home, assisted living facility, long-term care facility. And Medicare Part B covers certain telehealth services. Now, although there may be cost sharing, Medicare is allowing doctors to waive some of those costs as well. In all instances, I want you to remember the beneficiary and the provider must prearrange that telehealth visit, and the visit is documented on the beneficiary's medical record. Now, in addition to telehealth coverage, there is another Medicare service, and it's called virtual check-in. Now, the billing for that may differ. In fact, we did have a case recently I wanted to share with you about virtual check-ins. We had a report from the daughter of a beneficiary, and this beneficiary had received a bill for $180 for a less than 5-minute telehealth call. And interestingly, it was from a doctor that she had not seen in over 15 years. Makes you wonder, doesn't it? So in a pandemic, telehealth makes a lot of sense. But as with most billing, fraud, and abuse, the scammers exploit those legitimate benefits. And now that certain rules around using telehealth are more flexible for Medicare, it potentially opens up a pathway for the scammers and the fraudsters. So here's a case in point. We received this report from a California senior. She answered her phone to a caller. The caller was masquerading as a Medicare representative. And this so-called representative told the lady that she could get free braces. And all she had to do was give up her Medicare number, her address, and her date of birth. Well, unfortunately, the senior believed the caller. It was actually from Medicare, and she gave up all of her personal information. And sure enough, days later, she received a box of back braces and knee braces, elbow braces, and shoulder braces. And then she got suspicious and she called us, Senior Medicare Patrol, because she saw on her Medicare statement that Medicare was billed by this equipment vendor for a telehealth visit. Not only that, but she got a $25 COVID-19 telehealth bill from a company she had never even heard of in Florida. And a Nebraska equipment company had billed Medicare under her Medicare number for the braces for thousands of dollars in reimbursement for braces and orthotics. Now, keep in mind, this woman who got that call from a stranger, she didn't even need those braces. But now they're recorded on her Medicare record. Now, think about it. What's going to happen down the road when she actually needs medical equipment? Will the legitimate claims be denied? And what about her Medicare number? It was compromised at least twice, right, by a Florida company and a Nebraska company. How many more times is that Medicare number going to be falsely used to bill Medicare by other vendors before we can turn off the spigot? Makes you think. Now, switching gears, I want to talk about contact tracing. Now, contact tracing for COVID-19 has been in the news a lot lately. And as we continue to look for ways to stem the COVID-19 tide, we're implementing contact tracing across the country. Now, contact tracing seeks to track anyone who may have been exposed to COVID-19 and subsequently who they may have exposed. And contact tracing is an important element in our road to recovery. Well, unfortunately, the scammers see pretending to be contact tracers can get them ill-gained information like Medicare numbers or bank account information. So depending on how your state sets up the contact tracing program, legitimate contact tracers can call, email, text, and maybe after the pandemic, they can visit homes to collect this important information. And they are allowed to ask for your address, your health information, and clearly the names of places and the people that you have been exposed to. However, according to the authorities, the scammers will ask for way more information. Now, here are some of the things we need to know to protect ourselves and others from the fake contact tracers. Anyone who says you need to pay to work with a contact tracer is a scammer. There's no legitimate reason why a true contact tracer will ask you for your social security number, your bank account information, or your credit card number. Legitimate contact tracers will not need and will never ask for immigration status. And importantly, you need to know not to click or download anything if you get an email or a text from a suspicious contact tracer. Basically, just follow this advice. Get a call from a scammer, hang up. Get a door-to-door visit from a scammer, close that door. Don't respond to, click on, or download anything that may be suspicious, which is really good advice given the many, many, many dubious and malevolent websites there are out there today. Now, since the COVID-19 phenomenon, cybercrime experts tell us they have seen a staggering 1,000% increase in websites and internet names using COVID-19 to suck people in. Emails and text messages, all with one purpose in mind, to get you hooked, to get you interested so that you'll click on their link and get you to put in personal or financial information that you clearly shouldn't share with strangers. So here are some real, true examples. This first email claiming to offer a pandemic survival guide. Hey, save yourself and your family. Talk about playing on fear, huh? This next email, again, playing on fear that you might not be able to get the personal protective equipment that you need. Maybe there's a lack of hand sanitizers and masks and gloves. This email plays on your fears about the protective equipment and says, we're a medical appliance supplier in China. We can get you anything you need. Infrared thermometers, PPE, and other necessary medical supplies. Just click on our link. Now, this next test message we got, I actually got it on my smartphone, but we're seeing that there are a slew of text messages pretending to be either from Amazon or DHL or some other delivery company, asking you to click on a dangerous link. Now, the scammers are so manipulative, and they'll use whatever information is at their disposal. So think about it. Many of us, because of the pandemic, we're sheltered in place. We're ordering and buying from online sources. So a message that you get such as, gee, our truck was at your house today and you weren't home, and due to COVID, we can't leave your package, sorry, but click on our link, contact us immediately. Hey, that's pretty believable, but it's a scam. We've also been warned about registered internet names that appear to come from the Centers for Disease Control or legitimate charity or the World Health Organization, when in fact they originate from dangerous spammers. And those spammers try to lure you into their site so that they can download malicious virus software, lurking in the background of your computer, collecting personal and private information, and then sending it off to the scammers. So please, please, please be careful. Treat all emails regarding COVID-19 with caution. They are only looking for two things: personal information or money. The best advice I can give you about these fake websites, instead of going and clicking on a link that's sent to you in an email or a text, if you want legitimate information from the FTC, the FDA, the CDC, open up a new window on your computer, search for the name of that legitimate government agency, and then click on the link. Because I gotta tell you, the bad guys, man, all they're looking for is money. And speaking of money, boy, wouldn't the scammers love to get a hold of our government economic stimulus payment checks. They're trying. So here are some cautions from the Internal Revenue Services. Watch out for calls, emails, text messages saying that you have to pay first before getting your check. It's a scam. My husband got this text the other day on his phone. $2,500 deposited on your bank for emergency relief. And then he was instructed to click on that particular link, which he didn't, by the way. Be also aware of callers asking you to sign the stimulus check over to them. Be aware of claims that you have to certify certain personal information in order to speed up the delivery of your check, or claims by a scammer that they can help you get your check faster, or scammers who send a fake check to you and then lure you into giving up your bank account information to help you cash in. All scams. Be so very, very careful. Now, before we move on, I just want to point out something to you. There's a recent advisory that the IRS just issued, and it's about the receipt of economic stimulus checks. Now, many people have already gotten their $1,200 check. However, the IRS wants us to know that there are about 12 million people who are eligible to receive the stimulus payments, but could miss out on that unless they take action and complete some form through the IRS, and the deadline for that is October 15th. So I want you to share this. The 12 million people are typically people that don't file tax returns, very low income families with children, people who have been disconnected from work opportunities for a long period, and many low-income adults not raising children in their home. They have not yet received the well-deserved economic stimulus payment. So they need to go to this website, fill out a form, and send it to the IRS so that they can get that check. So please share that. Okay, so since the inception of the pandemic, just a few months ago, there has been an explosion of phony cures and therapies that the Federal Trade Commission has had to issue hundreds of cease and desist letters to. Linda said at the beginning that 160 may not. No, it is over 250 companies right now, guys, that are making unsubstantiated claims that they offer products and therapies that they can treat or prevent the COVID-19 virus. I know, it's crazy, huh? From music therapy to drinkable bleach. I tell you, it is amazing what people are willing to do to unsuspecting seniors, all to make a buck. Now, the one thing we do know is that there is no approved cure or therapy yet for the COVID-19. So please don't fall for this scam. And you know, I mean, how can you offer drinkable bleach to people and sell it as a real cure? Thankfully, I just read about one Florida district attorney who successfully secured a preliminary injunction order shutting down the online sale of an alleged miracle cure for COVID-19. Not only for COVID-19, he claimed that his cure also took care of Alzheimer's and dementia. And again, the alleged cure involved drinking a powerful and potentially dangerous bleach product. Oh, good grief. Now, this last bullet points, hot off the presses. The FDA, the Food and Drug Administration, recently came out with an alert warning consumers to stop using 55 hand sanitizer products from 10 manufacturers because those products may contain methanol. Now, methanol is toxic when absorbed through the skin or ingested. FDA says methanol is not an acceptable active ingredient for hand sanitizers and must not be used due to its toxic effects. And sadly, the FDA says it is already aware of adults and children who have recently died, been blinded, or hospitalized after ingesting hand sanitizer products contaminated with methanol. Sad. Now, we talked a little bit about genetic testing and cancer screening. I told you that that was a huge fraud scheme in 2019. But I wanted to point out to you how interesting it is here where the scammers take an older fraud and they transition it into a new scam scheme. So last year, like I said, we were inundated with reports of fraudulent genetic testing and cancer screening scams. Now, in this particular scam, laboratories across the country would hire marketers. Remember the marketers? And those marketers would go to senior fairs and health fairs, and they would, they would set up a table, and they would tell seniors that Medicare offered this free test to be able to tell if you are prone to cancer, maybe if your medications that you were taking are contraindicated, and all you needed to do was take a simple cheek swab test, and it was free from Medicare. And man, people signed up in droves across the country. And all the seniors had to do to get that free test was to give up their Medicare number. Yep. And of course, they did in droves. Now, of course, most of the people didn't receive a lab report, but guaranteed, those scam laboratories billed Medicare for millions and millions of dollars in false claims. And those expensive genetic tests were then recorded on the seniors' Medicare records. Fast forward to 2020. We are already seeing laboratories being investigated for billing for suspicious COVID-19 testing. Now, the laboratories, again, recruiting marketers, and those marketers are bent on capturing as many Medicare numbers as possible to falsely bill Medicare. Now, here's another actual case in point, this time from Texas. A Texas laboratory hired marketers, and those marketers went door to door, targeting our most vulnerable people, the elderly and the poor. And the marketers talked them into giving up their Medicare numbers and convinced them to do that cheek swab. And then for every senior that they got to give up the Medicare number and to the cheek swab, those marketers were paid by the laboratories $150 a piece. Then the laboratory, they would take the collected Medicare numbers and the DNA swabs, collude with doctors, send the claims to Medicare and Medicaid, billing those payers for $30,000 a test. That's what we call big time healthcare fraud. Now, if that isn't bad enough, this next scam is truly egregious. Bad actors using COVID-19 diagnosis to fraudulently enroll non-terminal seniors into hospice. Actual case. One hospice agency, a new biller to Medicare, they tricked a whole lot of seniors into giving up their Medicare numbers in exchange to get a COVID-19 test. And then the hospice agency falsely claimed that all 41 seniors had COVID, even though only 3 of the 41 people tested positive. Now, worse, all of these seniors who gave up their Medicare numbers and were falsely enrolled in hospice, they were then denied critical healthcare services that they needed. Why? Because Medicare hospice only provides comfort care. And these people listed here, actual victims of these fraudsters and scammers. Bree, who needed heart surgery, but because she was enrolled in hospice, her heart surgery was denied. Betty, enrolled in hospice without her knowledge, she couldn't even see her primary doctor. And John, again, enrolled in hospice without his knowledge, couldn't get the needed medications that he routinely took. No doubt about it. Fraud harms people. And sometimes that harm is deadly. Now, lastly, I want to talk about a health plan scam. Health plans like the Medicare Advantage plans have insurance agents that go out and talk to seniors and explain their health plans and enroll them in Medicare Advantage plans. And there are rules that Medicare provides, and those rules are how the health plan agents have to play and have to tell people what they can and what they can't do. Now, we're being warned about telemarketer robocalls. And what they're doing is they're taking advantage of vulnerable people who've lost their jobs and their health insurance because of COVID-19. These telemarketers falsely offer health coverage, claiming to be from big name payers. But they use misleading advertising. And this is what they're doing. Their robocall says, looking for affordable health insurance with benefits from a company you know? Policies have all been reduced nationwide. Big name companies, just a quick phone call away. And the robocall says, press 3 to get connected to a licensed agent, or press 7 to be added to the do not call list. Well, unfortunately, when a customer presses the 3 in order to find out about a health plan, they get connected to a telemarketer. And those telemarketers, they're not selling plans from the big recognizable companies. No, they've been hired by other clients, not the large well-known companies listed on the robocall. Now, some of these telemarketers have already been investigated. And the investigator shared with us that one of the telemarketers that had been doing this scam for quite a while admitted that he reached out knowingly to consumers who were on the do not call list because he believed they would be much more profitable to target. This scammer also told the investigators that he admitted to making millions of calls a day using spoofed numbers. And if you know about the scammers and how they spoof numbers, they can manipulate the system so that the telephone call looks like it's coming from a local area code. It looks like it's coming from a legitimate agency like Medicare or Social Security Administration, but it's spoofed. So you have to be so very careful. And although the predominant number of insurance agents are good and legitimate and factual, there are bad actors out there, folks. So we always recommend using the health insurance counseling and advocacy programs in California. They're called HICAPs. And out of state, they're called the state health insurance programs. And what they do is they provide free, unbiased information on Medicare and Medicare Advantage plans in their specific geographic location. So again, in California, there are 26 of those HICAPs, health insurance counseling and advocacy programs, and that 800 number will get you to the right county HICAP. And if you are outside of California, the state health insurance program locator is found at shiptacenter.org. So, as they say, so little time, so many scams to talk about. Now, in the next few slides, I'm going to detail the self-defense tips that I would really ask that you please share widely with clients, with patients, with friends, with families, with relatives, with anyone in your network. Because the fewer people we hope will be victimized by the criminals and scammers, because they will know this factual information. So please, please, please share widely. We talked about the people who are inundated with billions and billions of robocalls a day. Scammers going door to door, selling the COVID-19 virus test kit, even when we know that Medicare has already told us there will be no cost sharing for the test. We receive reports all the time about facilities that are giving the COVID-19 test, refuse to bill insurance, and then charge seniors anywhere from $50 to $250 a test. Watch out for the many products claiming to cure COVID. Always check with the Federal Trade Commission, ftc.gov, for their very long list of unsubstantiated claims. And there are people that are offering vaccines, even though, for Pete's sake, there isn't a vaccine out there right now. Ignore someone claiming to be a contact tracer if they ask for your Medicare number, bank account information. It's a scam. And always, always, always be suspicious of the websites and the emails and the texts that sound legitimate but clearly are not. Carefully research charities. There are so many scam coronavirus donation requests, phony charities, crowdfunding. Yes, there are legitimate charities created to help those impacted by COVID-19, clearly, but there are so many scams out there. Scammers who urge Americans to assist those who are suffering as a result of the virus outbreak, but they're really only seeking your banking and credit card information. And crowdfunding sites, my gosh, they're popping up everywhere. Best to be suspicious. Check them out carefully. And I do recommend Charity Navigator. It's one of the best websites, charitynavigator.org. They compile millions of records about these charities, and they do rate over 10,000 charities. Investment opportunities, please, please be careful. In this pandemic where unemployment is high and people are so worried about their 401ks and their money, crooked investments are rampant. So be cautious. And when people need medical supplies, oh my gosh, you don't get medical supplies from a stranger or a robocaller. And I want people to remember, Medicare will never call you and ask for your Medicare number. so many calls we get from people who really truly believed they had gotten the call from Medicare and it was a scam. And they were humiliated when they found out that they had really shared their private information with the bad guys. Now, to see if you need medical equipment, always consult with your own doctor. And if you do receive these boxes of braces, which believe me, a lot of people are getting, and especially if you didn't order them, refuse the packages. It is almost certain that some illicit equipment vendor is billing Medicare for thousands of dollars under your individual Medicare number. Now, as we said, some telemarketers are falsely claiming they can get you the best health plan money can buy, but it could very well be a scam. So please use the legitimate agencies, the HICAPs and the SHIPs for unbiased information. And if you get a call from a so-called provider asking to set up a telehealth appointment, verify that with your own doctor first. Importantly, review Medicare summary notices and explanations of benefits. A good way, and actually many times the only way for Medicare beneficiaries to detect suspicious entries on their own medical records. You always want to make sure the date of service is correct, the provider name is correct, the service description is what you got on that particular day. And although it's difficult, I admit, keep current with Medicare, COVID-19 scams, which, like I said, are evolving, and healthcare fraud. As I said at the beginning, the scams continue to evolve, and we need to always be on the defensive. Now, to make it really easy, I took all these tips and I published them in one tip flyer. It's available on our website at cahealthadvocates.org, and I do believe Consumer Action will be sending that out as well. So along with all these self-defense tips, it's important that we report fraud. It's the only way that we can help law enforcement get the bad actors out of the system. Now, to report fraud here in California, our Senior Medicare Patrol has the toll-free hotline, that 855 number. It's open for calls, complaints, questions about Medicare billing, potential fraud, anything you want to know, we will help you with. We also, as Senior Medicare Patrol, and there are 54 of us across the country, we provide free fraud prevention education, materials, webinars such as this one, all free, all open to the public, because information is awareness. And if people are aware, they are far less likely to fall victim to the scammers. Now, if you're outside California, you can find your state's Senior Medicare Patrol on the locator at the bottom of the screen, snpresource.org. So let me just leave you with this one request. Please share this information with your clients, your residents, your friends, your relatives, because the more they know, the less vulnerable they're going to be to being victimized by the fraudsters and the scammers. Fraud and abuse, people, is rampant. Protect yourselves, protect others. And I want to thank you for your attention.
That's great. Thank you, Nelson. If you have any additional questions, you wake up in the middle of the night and you think about a question, remember you can email Micki. There's her address there. If you don't remember that address, you have my email address. Please send me an email and I will forward it over to Micki. Again, a very, very special thanks to our guest speaker, Micki. As always, you were absolutely Fabulous. And thank you for taking time out of your busy schedule to join us today. Now, if you're not registered for our estate planning webinar, it's going to be a great one. You need to do so ASAP as we have limited space available. If you didn't get an invite, send me an email and I will make sure you get an invite. That's going to be a really, really good one. Again, thank you for joining us today. I look forward um, to welcome you back on August the 5th for our estate planning webinar. But in the interim, with COVID-19 just ravishing our community and our neighborhoods, please stay safe. The best. Goodbye and thank you again.